Okay, I think we're ready to go. Thank you for joining us for today's webinar, HIV Prevention Strategies for National Latinx AIDS Awareness Day. Para aquellos que quisieran escuchar el webinar en español, tenemos servicios de interpretación para este webinar. Si ustedes están atendiendo el webinar desde su computadora u ordenador, debe hacer clic sobre el icono de interpretación en la parte inferior de la pantalla. Es el símbolo que se asemeja a un mundo y luego presiona el idioma español. Si usted lo está haciendo desde su teléfono celular, haga clic sobre los tres puntos en la parte inferior de su pantalla. Luego haga clic nuevamente, pero esta vez sobre la interpretación de idiomas y nuevamente una vez más tiene que escoger el idioma español. Este webinar será en su totalidad en inglés. Al momento de escribir sus preguntas en la casilla de preguntas, si usted así lo desea, lo puede hacer en español. My name is Luis Alberto Mares Yáñez, Director of Community Mobilization at the Latino Commission on AIDS and Director of NLAAD since 2017. Today's webinar is being presented by a collaboration of the Latino Commission on AIDS and our partners at the CDC in the Let's Stop HIV Together campaign. Let's Stop HIV Together is the CDC's national campaign of the Ending the HIV Epidemic in the U.S. initiative, also known as EHE, and the National HIV/AIDS Strategy. Together is an evidence-based campaign created in English and in Spanish. It aims to empower community partners and healthcare providers to reduce HIV stigma and promote HIV testing, prevention, and treatment. As you can see, there is a lot of commonalities between Together and NLAAD, and that is why we collaborate to fulfill our goals and mission. Our webinar today is a celebration of NLAAD, where we can learn about HIV prevention and treatment with two special guests, Ronaldo Andrés Vargas Maldonado and Dr. Joseph Cherabie. NLAAD, National Latino AIDS Awareness Day, is turning 20 years on October 15. 20 years of hard work creating awareness in the Hispanic community, not only about the effects of the HIV epidemic on us, but also about ways to prevent and treat HIV and promoting testing. In recent years, we have seen the total number of cases decreasing in general, even among us Latinos, but we also see that the proportion of new infections year after year increases in our community. For the year 2021, we are 29% of all the new cases of HIV diagnosed in the country. This year, NLAAD is focusing on prevention. We think prevention is a very important pillar of the plan to end this epidemic and the pillar that will help reduce the number of new cases each year. That is why today we have the Together team here to talk to us about HIV prevention strategies from two different points of view, the community point of view and the clinical one. Before introducing our speakers, I would like to cover a few housekeeping topics. Today's webinar is being recorded. We will be able to share a link with you after the event is complete. We welcome you to revisit the content yourself and share it with your colleagues. We also invite you comments and do questions. Please look at the question and answer chat box on your screen. If you think of a question for the speaker at any point of the presentation, just type it here, and I will either post it to the speakers or at a time or hold it if to the end of the discussion, the end of the presentation or the discussion part of it. You all have been muted automatically when you log in. This is to reduce noise during the presentation. And for those who just joined us, we are providing interpretation from English to Spanish. If you need information about this, please put your questions in the chat, and the team will reply to you. At the end of the webinar, the browser will automatically open a survey for you to fill. Please provide us with your comments about this webinar, reply to questions. It's an evaluation of the webinar as well as evaluation of the entire campaign. And today's presenter is Ronaldo Andrés Vázquez Maldonado. Ronaldo is a person with HIV who works as an HIV advocate and community health worker in San Juan, Puerto Rico. As an advocate, visual artist, and educator, Ronaldo uses his HIV diagnosis and knowledge of graphic design and social media to normalize HIV conversations and raise awareness about HIV stigma and disinformation. Actively talking about HIV gives him an opportunity to raise awareness about U equals U and talk about HIV testing and prevention options like PrEP, PEP, and HIV treatment as prevention. Ronaldo encourages others to have conversations about HIV with family, friends, and partners to eliminate both new infections and stigma in communities. Ronaldo says we can have many breakthroughs and advances in HIV treatment, but stigma is still out there, limiting others to live well, test, prevent, start, or stay in HIV treatment. Let's talk about HIV and end stigma. Well, at this time, I'm going to hand the floor over to Ronaldo, who is going to start today's webinar with the first part of the presentation. Ronaldo, it's all yours.
Hello, everyone, and it's really good to be here with you all. It's gonna be a learning experience for all. We, as a Together, Let's Stop HIV Together ambassador, we seek to have to normalize HIV conversation and to end stigma. You can. Thank you. My name is Ronaldo Andrés Vázquez Maldonado. I live in San Juan, Puerto Rico. It's been 5 years living with HIV already. And the first year I made my diagnosis public to lift the weight over my shoulders. I was still in depression for the first 2 years living with the condition. But the past 3 years, I've been working and developing myself, working in the health field, making HIV testing, and as a community health worker. In my third year living with HIV, I got the opportunity to be, for the first time, a Let's Stop HIV Together ambassador for Puerto Rico. And it's been a great experience to combine my experience living with HIV and help others, giving them information from reliable sources like the CDC campaign and CDC itself. It's like promoting health. It's basically we want people to get tested and to know their treatment options, prevention options, and most of all, to stop stigma. Next, please. We have many roles as a CDC Let's Stop HIV Together. We get to participate in technical assistance and call and trainings and peer support. Monthly meetings they give you direction. You get to learn from different topics and how to do or help you guide and do the work effectively. That monthly checking with the liaison, it's really help. It really helps us to do our job as an ambassador in where we are. We ambassadors are located in areas that are HIV is where new cases of HIV mostly affects. Here in Puerto Rico will be San Juan, Puerto Rico. So the Let's Stop HIV Together campaign, we go to virtual events, activities, presentation panels, and conference like these ones, including Pride events. We have presence all or in different activities to share and develop the Let's Stop HIV Together messaging. We spend a minimum of 20 hours per month promoting the campaign, the Let's Stop HIV Together campaign, and the initiative. And we, along the way, cultivate relationship with other individuals, with health departments, organizations, people living with HIV, to increase the dissemination of the Let's Stop HIV Together campaign resources, to help other people know about their status, as we said, and to educate themselves about HIV and stop the stigma. We maintain an active social media presence where we promote HIV testing mainly and prevention messages that will have an impact on others, on the followers we have on our social media. Next. We have objective as Together campaign. The Let's Stop HIV Together, as we mentioned before, is an evidence-based campaign, and its aim to stop the stigma, to promote the HIV testing, prevention options like PrEP, condom use, and how treatments help us, people living with HIV or people diagnosed with HIV, to have a healthy life and to not transmit to others. The campaign addressed both consumers and health providers. We have the Dr. Cherabie here with us. It's a clinical ambassador from the Let's Stop HIV campaign. And we have community ambassador that mostly connect with other people as peers. As a Together ambassador, everyone has a role preventing HIV. We help other people to stay healthy. In Puerto Rico, we don't hear the messaging, the U equals U messaging. So it's very important for me, this Let's Stop HIV Together campaign, to raise awareness and to start conversation. So it really helps people to stay healthy or know their status. So Together campaign is part of the national Ending the HIV Epidemic. It's an initiative in the US to help people know their status, to get on treatment, to know and to get prevention services and options, and to respond to clusters. Mainly what affects us, people living with HIV or not, it's the HIV stigma we've coming to fight since the early beginning of this epidemic. And the Let's Stop HIV Together, it gives us a role. Each person has a role. It's an important role to stop HIV stigma, and it gives voices to the people living with HIV, and as well as their family, friends, and partners. You can see the CDC materials from the campaign that involve not only the persons as ambassadors, but also their families, their partners, and friends, sharing that messaging and talking freely about HIV without stigma or without shame. Some people, it might be taboo, or it's not the preferred conversations to have, but it's very necessary that we all have this conversation about HIV and how we can prevent it or stay healthy with treatment. So a campaign participant shares their story and call everyone to help and work together, because it's how we can end this real epidemic. We can like invite others to have this conversation and also to share the materials we have in the Let's Stop HIV Together. As I said before, I've been living with HIV for 5 years, and I know it's not the same as the early in the epidemic to being diagnosed with no treatment, non-information. But as for now, 5 years ago, what affects me the most was the lack of knowledge and awareness and information I had about HIV. So internalized stigma was something I got to work and to deal with, knowing my HIV status. And we can all have a part, as the Let's Stop HIV Together says, in ending this, in stopping this stigma, in helping others to educate themselves, have more knowledge or prevention options. And with the materials we have in the campaign, we can raise awareness. We can use our voices, our platforms, and start this conversation all along in different places. So there's still stigma. It affects us all. If we really want people to know their status, we gotta stop the stigma. It prevent people to get tested. It is rooted in fears from the beginning of the epidemic. It's mainly that lack of information and outdated beliefs about HIV and how you can get it. It's mostly that stigma, negative judgments, and attitude toward people that live with HIV. Stigma, it's something that really affects us when we live with HIV. It affects our emotional being, our mental health. You can state in the next in thank you. Affects us like our emotional being, our mental health of people living with HIV. We have treatment that works well, but if we don't address stigma, people not necessarily are going to get tested or to get in treatment. So with that internalized stigma I go through, and many people living with HIV, we get to create a negative attitude or image about ourselves, and it's really hard to get through that phase. We have a self-image about ourselves. It affects our self-confidence, our self-esteem. People might be afraid from being discriminated if their HIV status gets revealed to other. It's some people go through isolation, and it's not really a good thing. It affects us, our mental health and our emotional being. So there's no need to be shame if you're living with HIV, but most people live with shame and or are shamed by others and might not get the prevention or treatment services they might need. So we get to know that undetectable equals untransmittables. It's the work that the HIV treatment does when the person living with HIV got diagnosed and started its treatment. It's important to find a medical provider that can guide you through the process, that can help you with HIV treatment, and you start that journey to become undetectable. Undetectable, if we all get to know, it's when our viral load or the amount of the HIV virus in our blood or bodies, it's extremely low. It's effectively no risk. There is no risk transmitting to other people in sexual contact. And it's really important for us that messaging to help other people understand that we are not living viruses. We're human, we're persons with a virus that we can control with treatment. So as for now, people when they got diagnosed, you get to seek medical attention. It's good to have a medical provider where you feel comfortable, where you feel like supported along the way and give you options for you to stay healthy. That helps you, helps people living with HIV to maintain to get to that viral load suppression and stay in that viral load suppression. So there's effectively no cure as for now, but the treatment works. And we encourage people when they get tested and they receive a positive result to start treatment, to know or engage with this conversation with their medical provider so they can know their options, treatment options, and how to take care of their health. As a person living with HIV, I had to make some changes in my lifestyle because I wasn't eating good. I wasn't taking care of my mental health or my physical health. So if we would like to live healthy and with an HIV status or diagnosed, we have to take care of ourselves. So it's important to change our lifestyle or be conscious how we can help us live longer and healthier life. And being undetectable is one of the ways we can have the virus control and not transmitting it to others. It's one of the benefits of being in treatment. So it's very important for people when they get tested and have a positive result to connect with medical treatment and care. What we are seeing right now here, it's materials from the CDC, from the Let's Stop HIV Together campaign. They have resources and materials that help people understand their process. If it's not the person living with HIV, someone living with HIV nearby them. So it's very informative and educative, and it helps others to know what we go through when we start treatment. As I said, there's a lot of CDC materials and information we can share with other people. These are some examples that can guide people when they know their status on their journey to become undetectable, that help us guide people in that journey, knowing and giving information and letting them that medical care is really important, and the HIV treatment as for now, it really helps us to live healthy and longer life. We can do anything. We can have couple, we can have children if we want to. HIV doesn't stop us, but if we don't have the correct information and we don't get to believe this information and we keep on with the stigma or misinformation or false belief around HIV, it's really hard to take this journey up forward. So with these materials that we have on the CDC, Let's Stop HIV Together, we look forward to start this conversation with family, friends, with other people that has been recently diagnosed, and to guide them in whatever journey they are in. If they have a positive result, there's a lot of information, inspirational materials also from other people living with HIV and their testimonies and how they overcome stigma and how do they live healthy with this condition. Because if we still, as I said before, if we're still thinking that we're gonna be living sick, or if we are gonna die because we have HIV or AIDS, we might be afraid to understand, or it might be too hard to understand this information, and it's really helpful. It's simple, it's something we can get to others to share, and as I said, to start conversation. Next. It's in everything we do as an ambassador, it's really important for us to deliver this messaging and these materials we have, but also we have the CDC Let's Stop HIV Together, a web page that it has information from testing, treatment, PrEP options. It has ways to end stigma and how we can, in some way, can identify people that are stigmatizing languages, that use stigmatizing languages, and how we can help others educate themselves. As for now, this Let's Stop HIV Together has an initiative with Together Take Me Home that helps people order up to 2 HIV testing, including if you are living with HIV, you can order up to 2 HIV testing, self-testing kits for people you might know that might be at risk from getting HIV. And it's a really good way to start conversations. This initiative is focused on people mostly affected by HIV. We know Latinos are mostly affected and disproportionately affected by HIV in the United States and Puerto Rico, and the Black people. So offer it to everyone, to gay people, transgender people, to women, to give them access and to help end that barrier stigma creates around people getting tested, and to start that conversation and letting them know that it's really important to at least once a year or every three months or every 6 months to get tested. And this conversation needs to go and go and go. So it's up to us to stop HIV together. It's how we can end this epidemic. Even if we are not ambassador, we all are. We need to take a role and responsibility ending the HIV epidemic. So HIV Together has many resources, as I said, that can really help us guide other people, including this locator that people in the website can seek prevention options, condom, PrEP use, or to get into treatment nearby them. They get to put their zip code areas, and it has really helped me to help other people from Puerto Rico and from the United States that ask me or get to ask where they can get prevention options, but I still refer them I guide them and navigate them. But it's a really good tool to know other places around you so you can stay healthy or help others stay healthy. Might be your friends, might be our partners, some people that move to another city, but it's really helpful to know where we can get tested. It's not just having the conversation and get tested, and it's like providing options for people to know where they can take care of their health. And as for me, living with HIV, it has been a whole experience. Now I know I can die from this. I will die from other conditions when I get older, but like it's really important for me to end that stigma and let others know that there are women living with HIV, there are mothers living with HIV, heterosexual men. It's not only a gay disease or a gay infection, as some people from that negative thought or stigma still believe. It's a virus that can affect all of us, and we all have a part ending the HIV epidemic. So as for me, I encourage as a CDC ambassador to you to use these materials, to visit the CDC Together campaign and use the materials. You can order materials for your organization or for yourself as an individual, and you can start this conversation with others to really help end the HIV epidemic. Thank you all, and be safe, and may you live in health.
Thank you very much, Ronaldo, for this presentation, and thank you very much for addressing a lot about stigma, which is a big problem in our communities. As you mentioned, we may have all these advances to prevent and treat HIV, but if we don't treat stigma within our community, it's going to be still very hard to end this epidemic. And now our second presenter, Dr. Joseph Cherabie, whom I had the pleasure of meeting virtually at the CDC webinar for HIV National Testing Day, in which I was part of the panel. When I was informed he would be a presenter for this webinar, I was more than happy because I know the quality of his presentation. Dr. Joseph Cherabie is an assistant professor of medicine in the Division of Infectious Diseases at Washington University in St. Louis. He also serves as the medical director of the Washington University St. Louis CDC Midwest Track 2B Capacity Building Assistance Program, medical director of the Washington University St. Louis PrEP Clinic, associate medical director of the St. Louis County Sexual Clinic, and the associate medical director of the St. Louis STI HIV Prevention Training Center. Dr. Cherabie specializes in sexual health care, focusing on the LGBTQ health, sexually transmitting infections, and HIV, all within the lens of medical education. They are the co-author of the Washington Manual of Medical Therapeutic chapters on STIs and HIV, and have contributed to the National STD curriculum. He mentors medical students, residents, and fellows through his work with the OutMed at Washington University and gives lectures for the LGBTQIA+ access to healthcare, LGBTQIA+ research methods, and STI. At this time, I'm going to hand the floor over to Dr. Cherabie, who will complete today's webinar with a presentation. Dr. Cherabie, it's all yours.
Thank you so much. Thanks for having me on. It's nice to see you, Annalise. Can we go to the next slide, please? So that's me. Hi, everyone. So I want to start off by talking to you all as a clinical ambassador for the Let's Stop HIV Together campaign and what it means to be a clinical ambassador, what our clinical ambassadors can do for you all, and what resources we have in order to make you all aware of what's out there, especially if you are a clinician or work with clinicians or work even in programming. And there are a variety of resources that the CDC has and the most up-to-date content with respect to HIV treatment and prevention. And so as a clinical ambassador, I am one of many. Clinical ambassadors are internal medicine and infectious diseases clinicians. So we are recognized as experts within our field. And our goal is to promote the Let's Stop HIV Together campaign resources. And so again, this could be through talks as we're doing here today, but also through social media and through training and technical assistance that we are always happy to provide within our respective regions. So next slide, please. I said that there's many of us, and I wasn't lying. So Dr. Oni Blackstock, you have Dr. Jason Farley, you have Diane Brusso, as well as myself, and then you have other ones coming up. You have Dr. Hansel Tooks, Dr. James Simmons, Dr. Sampath Wisinji, Dr. Asa Radix, and Dr. Anu Hazra as well. And so each and every one of us, what I love about this group of individuals and working with this group of individuals is each and every one of us, if you look at our respective profiles, which the website is available, you'll see that each and every one of us has a different background, comes from a different level of training, different level of clinical practice. And each of us brings that expertise and that viewpoint and that lens to the CDC CDC materials and promoting it. And so I learned so much from each and every one of these colleagues, as well as our fantastic community ambassadors, which you, of course, just heard all about. And so again, this is meant, our goal is to try and serve as the clinical viewpoint for a lot of these CDC guidance in order to help with that, but also to be one part of a larger picture of what it means to end the HIV epidemic ultimately. Next slide, please. And so part of the tools that we have, especially on the clinical side, is the HIV nexus. Now, this is something that I am, when I found out about this nexus, these resources for clinicians, I started beating myself up because I searched for years to try to find resources to share with people. And it wasn't until I was a clinical ambassador that I actually learned about this. And I was like, I could have saved myself so much time in order to, share the latest and greatest findings on HIV linkage to care, HIV prevention, decreasing HIV stigma. So this is constantly being updated by the CDC, and you have information for clinicians as well as and I use the term clinician broadly. I believe anyone who works in a clinical setting is a healthcare clinician. And so everything along the spectrum of HIV screening, prevention, treatment and care, transgender health, updates to treatment guidelines and prevention guidelines, as well as materials, infographics, and pamphlets that you can print out, put in your office, and make sure that you, again, have the most up-to-date information with respect to any of these topics. Next slide, please. So I wanted to highlight the updates to HIV prevention a little bit. And this is some of the HIV prevention materials. And as you can see here, there's a QR code at the bottom of each of these things for all of us, all of these tech-savvy individuals. But this is a clinician's quick guide. And what this does is, again, it tells us what PrEP is, how effective PrEP is, who is PrEP for, what are the oral formulations of PrEP, them being Truvada or tenofovir disulproxyl fumarate with emtricitabine and Descovy? What differentiates the two? Who meets the qualifications for Descovy versus Truvada? What about injectable PrEP, including injectable cabotegravir, trade name Apertude, and more information on that, and guides to discussing sexual health with your patients and normalizing those sexual health discussions, which I just want to take a second to emphasize this. We can't talk about HIV prevention in any way or form, or HIV treatment in any way or form, or HIV screening in any way or form if we don't take a good comprehensive sexual history. And all of these resources, again, are available via the CDC website. But again, this is just a quick guide that you can give. I can say that myself, being guilty of this, clinicians oftentimes don't have a lot of time to look over things and look over big guidelines of 118 pages. So sometimes a quick guide can be very helpful at getting a point across and trying to normalize these things, right? A lot of people are very intimidated by HIV PrEP. And our goal is to make sure that all providers, especially primary care providers, individuals who work in the prevention realm, HIV providers, all of them feel confident in prescribing PrEP and knowing where to look for resources with respect to PrEP. Next slide, please. So this is an example of the guide in which they showed the updates to the treatment guidelines. Now, I can tell you, I have read the treatment guidelines myself. It is around 120 pages. It is exhausting and very, very dry CDC material. I apologize for any CDC folks on this call, but we all know that it is a very hard read for people to get through. And so what are the key changes with respect to PrEP? This clinical guide, this quick guide actually helps highlight what those key changes, which includes that individuals who would benefit from PrEP are any sexually active adult or adolescent. And we should talk to any sexually active adolescent or adult about PrEP. And so we should be able to more easily identify individuals who would benefit from PrEP, but also to prescribe PrEP to any person who is asking and requesting PrEP. It goes over the updates to the HIV laboratory changes. Some of them make testing a lot easier and have a decreased amount of tests that we have to do each visit, including, for example, screening for kidney disease. If a person doesn't have any underlying kidney disease or is less than 50 years of age, they don't need to be screened for their creatinine as frequently. It also goes over the recommendation for HIV laboratory testing and other laboratory testing. It goes over as well the evidence and the USPSTF grade ratings of use of PrEP and how actually injectable cabotegravir oral Descovy, oral Truvada have all a grade 1A rating, which is really, really exciting because that is the highest level of evidence to show that PrEP is effective, up to 99% effective in preventing HIV acquisition. Ongoing assessments, it goes over all of the assessments for oral PrEP and for injectable PrEP. And I will tell you as well that there are breakdowns and tables that you can print out, cut out, and put up in your office for your clinicians. That way they can know what is required for follow-up of PrEP. And I will tell you, I am an HIV primary care provider. I've been a primary care provider for around 7 years, and I can tell you, taking care of PrEP is way easier than taking care of diabetes and hypertension. It is something that there are clear guidance on, and clear guidance on what to do if any of the tests turn back positive as well. Next slide. This is just further updates on the PrEP guidance that I just wanted to highlight. Recommendations for same-day PrEP. We know that individuals who could benefit from PrEP, if we start them on PrEP the same day of their evaluation, they are more likely to take it. And so decreasing the barriers towards starting people on PrEP. If they have an HIV test, and that HIV test, especially a 4th generation HIV test, is non-reactive, they should be able to start on same-day PrEP right away. And then making sure that they get linked to PrEP navigation and other people who could help with payment assistance, including working with your pharmacy colleagues to make sure that they are aware of the ins and outs of the patient's insurance status and what programs are available to help them. Teleprep is also available and is underutilized, but should be more increasingly utilized in this post-pandemic or peri-pandemic world that we happen to live in. And then there's also on-demand dosing for PrEP, especially for men who have sex with men who are taking Truvada and who have less than one sexual partner a week or one sexual activity per week. Then they can do 2-1-1 dosing, which is where you take 2 pills of Truvada 2 to 24 hours before having sex, 1 pill 24 hours after having sex, and 1 pill 48 hours after having sex. And that's equally as effective, even though it's not FDA approved, equally as effective as taking it daily. And our goal is, as I stated earlier, to make sure that primary care is available for PrEP patients, and patients should be able to obtain PrEP from their primary care providers as well. Next slide, please. There are a wide variety of resources that are available, and I do want to highlight the fact, Andrés did a great job of showing a lot of these materials, but these materials are available in multiple different languages, and just normalizing discussions about things like HIV PrEP and starting the discussion about HIV prevention is of the utmost importance. We want to make sure that this becomes a normal conversation in every sexual health conversation. And the more people we can get on PrEP, the better. In increasing awareness, but also decreasing hesitancy and discomfort with respect to starting PrEP. We know that PrEP uptake has been very high amongst white individuals who meet indications for PrEP, and we're still lagging behind among Hispanic and Latino MSM and Black MSM, but we have to ask ourselves why, and all of that starts with starting a conversation about PrEP and making sure that we're meeting our patients where they are at. With respect to their sex lives, how PrEP can work for them, and if they can benefit from it. So PrEP is changing the HIV conversation. While HIV treatment is fantastic, and we need to emphasize the U equals U message, on the other side, in order to have a true status neutral approach, we really need to work with individuals who are not infected with HIV and work on trying to make sure that they decrease their likelihood of acquiring HIV through the use of PrEP and other modalities. Next slide, please. So these are also materials for patients. Again, now is the time to find out about PrEP, decreasing the likelihood of acquiring HIV, and also discussion of PrEP for women. And Obviously, PrEP makes and discussions about PrEP makes everyone smile, as these pamphlets show you. But honestly, it's really, really great resources to take for your patients and to remind them how PrEP can benefit them in their sex lives and, again, meet them where they are at. Next slide, please. So that is it for my part. I do want to thank you all. This is my contacts as well as my Twitter and my threads. Please don't hesitate to reach out with any questions or concerns. And we're always happy to help myself or any one of the clinical ambassadors with any clinical questions that you may have.
Thank you very much, Dr. Cherabie. Thank you for explaining us everything about PrEP and all the possibilities that we have now, many different ways to prevent HIV. So please, as I said at the beginning, you can ask your questions in the question and answer chat box. If not, in the meantime, until they get form and write questions. Andres, how, in terms of your activities as ambassador, how does it make you feel to be able to go to the country and meetings and presentations and tell people about this, all this information that you have? Also, I wanted to add, I was surprised when you mentioned that you put your message to talk about Puerto Rico. What do you think of that?
It's okay. Can you repeat? It says in the chat as well. Can hear you well.
Oh,
And
can you hear me now?
thanks. Yes, I do.
Okay.
I heard the last part about U equals U, and the first thing about being ambassador, I heard a little bit.
Okay, what I was saying is like, how does it make you feel to be able to go to different conferences, activities, webinars, and talk about these issues that you're talking, addressing a stigma as an ambassador of CDC, Let's Stop This HIV Together campaign. And second part is like, I was surprised when you mentioned that you, because your message is not being talked in Puerto Rico. What do you think of that?
Well, as an CDC ambassador, it gave me pride to work alongside other ambassadors. As Dr. Cherabie said, I'm not alone. I'm here in Puerto Rico, but there are other ambassadors along the nation, and we get to collaborate on social media. And when we get to go to conferences, not just between us, but with other organizations. So it's a really good way to make network and to expand our reach. So when people I never imagined when I started the CDC campaign, I started with 485 followers, and as for now, there are 30,000. And there are people in need. There are people looking for services. There are people with stigma, people not just living with HIV, but their families. And getting to know other people and ambassadors helps me. And the tools we shared also to link them to care, to link them along the nation where they need or with what they need. And for the U equals U messaging here in Puerto Rico, you don't get to hear it as much as often. We last year have the USCHA conference here in Puerto Rico for the first time, and there were banners and flyers and information all over the place, but it's not a messaging you get to hear constantly. So for me, as a person living with HIV, I'm compromised to deliver that message and to expand what other has been doing, because I'm not the only one doing it, but we all need to do it. And it's not like I do it and put it on a check mark. It's like how we do it like constantly, so we get to raise awareness to stop stigma and other people to, because when a person have a negative test result, they can start PrEP, okay, but when they get to meet another person living with HIV, they don't know about U equals U. So it's like educating all along and trying to give that everyone that information so everyone could know, mothers, family, friends, people living with HIV that also have their doubts. As for me, it took me like 8 months to understand U equals U messaging, me living with HIV and being undetectable on the first 3 months. So it's something we all have a part and role in this to end the HIV epidemic, to help other people stay in treatment and to know this messaging as well.
Thank you very much. I just have to share here. I'm a U because you ambassador. So that's why I was asking. Like, I was also at UCHA in Puerto Rico. Amazing time. A great conference, of course. And I didn't know that you because you wasn't so well known. I mean, even here in the States, sometimes you can find people that don't believe about you because you have to teach them and show them and given the information, the scientific basis of this, and even though people don't believe sometimes, but anyway, we have to continue doing the work. So, Dr. Shabby, you talk about PrEP, and PEP, and the ways of the administration. But Andres mentioned stigma, which is one of the main blocks for people to address the HIV. So, what do you think from the clinical perspective as a doctor? What your colleagues can do to fight the stigma?
Thanks for that amazing question. Stigma plays a role in everything that we do, right? Let's be honest about the field that we work in. We're talking about oftentimes individuals who have acquired an infection via sex or via injection drug use. And neither of these topics are openly discussed in society without a certain element of stigma, right? For years, people have been told that if they get HIV, that it's some form of moral failing or that they've done something wrong. Same with STIs, right? I see it every day in my clinic where patients say, oh, I know it's bad. I don't use condoms enough. I made a mistake. I slept with the wrong person. I sleep with too many people, all of these things. And there's so much stigma that people internalize all the time, right? And as a provider, and what I love that the CDC is slowly starting to do more and more is realize the role that healthcare providers play in reinforcing a lot of this stigma, right? Finally, we're able to openly say, and we have big organizations openly saying U equals U, undetectable is untransmittable, right? We have people openly saying that if you take PrEP, then you're no longer a high-risk individual, right? You are an individual who's taking control of your sex life and decreasing your likelihood of acquiring HIV. And so as providers, our role should be to look at how we talk about these things, look at how we talk about HIV testing and HIV treatment and HIV prevention, and adapt in a way that works for our patients and ask the community that we are working with how the language we are using affects them, right? Because I myself have been a STI patient. I have been a PrEP patient. I know what it's like. I know what people say. I've been told that I have too many sex partners. I'm going to have HIV if I don't use condoms. You really should be using condoms all of the time, all of this stuff. So what we need to do is learn how to normalize discussions about sex in all clinical settings, learn how to talk to people and adjust our methods of screening individuals for PrEP so that they are less stigmatizing, learn how to treat individuals with HIV as individuals first and foremost, not as a person with an infection or an infected individual or some kind of danger. This is a person living with HIV. And I like to oftentimes say thriving with HIV because it is an infection like any other, and it doesn't need to be this big label. So we've adapted so much in our treatment modalities and our prevention modalities. We need to change our language to meet where we are currently in the times. And I think that's what we're slowly but surely doing.
Thank you, Cherabie. Anything you want to add anything, Andres?
Not to me, it's as Dr. Cherabie says, the language is very important, and the Let's Stop HIV Together campaign has materials and resources to address these stigma-related languages or phrases that people might use and how to educate others. So it's very important, as Dr. Cherabie said, to meet people where they are and to help them understand the importance of prevention or this messaging we're delivering.
I mean, I understand very well. I was lucky enough to have a provider that was very open-minded and free about everything, and I feel very comfortable talking to her. It was a doctor woman. She has retired. I'm so sorry now. So it felt when you feel comfortable with a provider, you can talk about anything, and that's gonna create a better relationship. And the provider can also give you any type of information that you're gonna take easier. And when you were talking about stigma and all these preconcepts that they have about sex and drugs, and I think it's also very much related to our religious background sometimes in society, which point us as sinners and all those things. And that's why the commission is working with in New York City with a group of churches, the Latino Religious Program, and I think it's important to address those issues with the leaders of the churches in the country, so they can also learn and be able to translate that to the people who go to the church. So I hope whoever is attending today from different parts of the country, bring this message to your church and tell them freely that it is necessary to normalize sex talk, HIV talk, AIDS talk to end this stigma, and together we can end this epidemic. If not, it's going to be still a hard work to do. Anybody? No questions, chat. Yeah, everybody's writing this amazing experience, and they are grateful for the information we are providing here in the webinar with the two experts here. So let's wait for a couple of minutes. And if anybody wants to ask a question, please write it either on the chat or the Q&A chat, and we will answer. I had another one that I want to ask that I forgot right now. I'm going to try to remember.
We actually do have a question from the chat.
Oh, perfect.
They asked, what has been the most successful community event or experience to bring people together for prevention and treatment services? So whoever would like to respond to that question.
Okay, as for now, most of the services I know, San Juan in Puerto Rico is where most cases of HIV we got every year. But Puerto Rico is not just San Juan, and we get to have the Pride event, the biggest Pride event in sorry for my dogs, in the west side of the island. And there we can get to, I had the opportunity to collaborate with migrant and other community organizations or organizations across the island and help them meet their expectations in Pride events. So Pride, or here in Puerto Rico, is where most people gather from all over the island, from here, from San Juan, from other places, and it's a really good way to share materials or to bring them closer to where the HIV testing are located. As for now, I'm not doing HIV test. I started working with a CBO doing HIV testing, but as for now, I'm a community health worker, and I get to, as an ambassador, also to deliver or to navigate people to where to get tested. And Pride events, it's a really good way to remind people that if we're enjoying our sex life, we can also enjoy preventing and not just be afraid of what might happen because I was exposed, and to deliver not just materials from the CDC, but also condoms and nada, making them aware that HIV testing is something they gotta do, like every day, every year, or have to have the conversation with their friends if they are like already in PrEP or HIV positive.
So I'm not just saying this because Andrés is here, but community health workers are the future. And I say that openly and honestly as a clinical provider because if we want to enact change in communities, people need to see themselves in the changes we want to enact. And so one of my favorite sayings by one of my colleagues is, you can't get to the message if you can't get past the messenger. And if you don't have the right people in positions of power in your clinical practice or in your organization that represent the community that you're aiming to serve, then ultimately you're failing the community, because you need to have people that understand what this community's needs are, how to communicate things to each community. It's not a one-size-fits-all approach, right? And so I live in Missouri. I live in St. Louis. St. Louis, certain parts are predominantly Black and other parts are very rural. And so I can't employ a one-size-fits-all approach to the communities that I aim to serve, right? Instead, what I try to do is get people who could speak to the experience of the individuals that we are speaking to. And unfortunately, oftentimes that means that there's a certain tax on people who have this lived experience, who are called on multiple times to share and to educate. But what that also allows is for people to see themselves in the in the projects and in the organization that we try to do. So again, working with community, not at community or for community, working with them is the most important thing. So I want to go to your Pride event in Puerto Rico is all I'm saying. Please invite me. But just making sure that as a clinical provider that I love the fact that I have people on my team that are part of a wide variety of different communities, and that makes our team stronger and it makes our interventions a lot stronger as well.
And I would like to add to Christopher and to everybody who's here for different organizations that you can be part of this. You can create your own events, and that's why we have so many awareness days. Like this time is Latino AIDS, Latino Latinx AIDS Awareness Day, and there's also the Black Latino AIDS Awareness Day, the Gay Men AIDS Awareness Day. We have all these different awareness days that we can have events and we can promote prevention. We can promote testing. We can promote treatment. And give information to our communities. You, the community-based organizations, are the ones who know the best your communities and what their needs are and how to approach to them. You can create an event that is going to be very attractive to them, so they can go to your event, and then you can do testing. You can do referral to prep, or provide links to get treated in cases that are positive. So all of us can do this. All of us, every organization in the country, can create events and make them successful and the most successful among everybody. I can tell you by NLAAD, which is the National Latinx Awareness Day, happened on the 15th of October, but events are already happening now and will continue happening until after the 15th. And through my experience working for this, I've seen amazing events like drag queen shows, like beauty pageants, like food, uh, car food trucks, festival, dance festival, everything that comes to your idea that's going to attract people. You can create it and do it. And if you need any support, just let us know. We provide with testing kits. If you need HIV testing kits, we can provide you that. So all you need is contact us within time, and we will help you to create your own event. So I want to promote endless here. um, there's a comment here from Jacqueline. She said, like representative of the community in the west of Puerto Rico, there is a need for more activities that promote the education and prevention because everything stays in San Juan.
Yes, I was like adding that because, as I said before, Puerto Rico is not just San Juan. I know ending the HIV epidemic focuses on San Juan as the main area where most cases of HIV are every year, but I get to help people from across the island. And it's people go to San Juan, but they go and live in other places around the island. And there's not too many messaging, there's not too many activities, there's not too many information in those rural areas. Also, I'm from the north of Puerto Rico, but I study in the center of the island all my life, and there is taboo. You don't get to talk about sex in the mountains, and God forbid. There definitely needs to, we as an ambassadors and clinical ambassadors are here to collaborate. We're here to extend that messaging with whoever, as you said, Luis, whoever is making an event, or how we can engage with other people that are already making different kind of event, not just HIV related, could be health related, but could be for anything totally different, not just health related, and include the messaging and the materials we have on the CDC.
Yes. It's
As
almost
Jacqueline
time.
says, there's
Yeah.
no,
Go
it's
ahead.
just in that, and in the mountain we don't get to hear this messaging and the information doesn't go, and people live there. So it's like we need to expand this messaging, and it's our responsibility, not just as ambassador, but as people. We know other people, so we start in this conversation, we can extend this messaging.
Well, thank you, Jacqueline, for offering your help to Andres to work in Puerto Rico. That's great. It's almost time to finish. It's been an hour of working and we are together. Thank you very much, Dr. Cherabie. Thank you very much, Andres, for being here with us. And thank you to the Together campaign and to providing us speakers to this webinar. Our next online event is a virtual meeting with the NLAAD ex-director, including me, tomorrow at 4 p.m. We're going to be talking to everybody who directed NLAAD from the very beginning to now. 20 years of hard work creating awareness in the Latino community. It's going to be very interesting because I'm learning what happened 15, 20 years before, how this campaign started, and what changes it went through. It's very interesting. It's going to be very interesting. I've been chatting with them on the phone, and I've been hearing so many things that I didn't know. I direct NLAAD now, so I'll be there too as part of the panel, and I ask you to join us. And it's not going to be a webinar; it's different. It's going to be a chat, a conversation between us, seeing anecdotes about NLAAD, pictures, and things that you may enjoy. So I hope you join us tomorrow. And our next webinar is going to be on October 10th. It's going to be with Ace View, and it's about PrEP use among Hispanic. So until then, see you, and thank you again to the campaign, to Joseph, to Andres, and Brigitte who coordinated this with me. Thank you very much.
Thank you, everyone.